Hi everyone, thanks for joining me today for Family Matters. I'm Nicole with Our Children, Our Future La Cloche Early On Child and Family Center. Thanks for joining me. And today we are talking home births versus hospital births. So let's talk about home births. Home births are done by certified midwives, and they are done within the comfort of the person's home or a close relative or a friend's home. They can even be done in a clinical atmosphere as well. Some birthing centers are available at times for women to give birth outside of a hospital setting. Women like home births because it provides them with a sense of safety, intimacy, and comfort. And they are usually able to share this experience with more people than what the hospital regulations and rules allow. Something you do need to be aware of when you do a home birth is that there are very limited access to certain types of medication. Obviously you can't have an epidural, but there are other methods that can be used for pain management as well. You are not able to have a home birth typically if you are considered a high-risk patient. And usually a high-risk patient is somebody who might need to be followed by an OB/GYN because of special circumstances within your pregnancy. So this might vary person to person. However, this is something that can be discussed with your midwife, practitioner, when you decide that you would like to have a home birth. For those who choose to have a hospital birth, this is super common as well, and people choose hospital birth for different reasons. Some want the option of having the epidural available. Some like the idea of being more of a clinical setting so that if something were to happen, everything's available right there. If they're anxious or worried, there's a full medical team on standby. Also, birth can be quite messy, and some people don't feel comfortable having that at home and they want it to be taken care of for them. So let's talk a couple myths about midwifery. So I've actually taken this from the Sudbury Community Midwives website, or sorry, Facebook page, and they're the favorite myths about midwifery. So oftentimes it said you have to have a home birth, and this is not true. If you choose a midwife, 60 to 70% of the clients that go to Sudbury Community Midwives choose to give birth at Health Sciences North, which is the local hospital, but it is completely your choice. Another one that they see a lot of is you can't see a midwife until you're at least 12 weeks along, which is not true. Depending on availability, they might book your initial visit as early as 8 weeks. Another one is you have to go see your family doctor first, or you have to have your pregnancy confirmed by a doctor. And this is also not true. Once you've found out you are pregnant, whether it be by home pregnancy tests, blood tests, or you've had it confirmed by a doctor, you can self-refer on a website, on their website, or give them a call to try and see if there's any space available. You can hire a private midwife. So this is actually false. In Ontario, registered midwives are fully funded by the Ministry of Health, which means they are covered under your OHIP. So it does not cost anything to have a midwife, and it will be covered under your Ontario health insurance. Wait lists are long. Now this is not completely true. So depending on how many people are giving birth and how many clientele they have, it will depend on their spaces. People also move, unfortunately, people miscarry, or they leave care for other medical reasons, which leave gaps in certain months. So they do have a wait list, and a lot of times they will call people on their wait list if they can fit them into that schedule. Another big one is midwives don't do epidurals. So this is also false. So last year, 39.3% of the clients at Sudbury Community Midwives chose to have an epidural. The only thing with this is you do have to have a hospital birth if you would like to have an epidural, but it can still be with your midwife. Number 7 is midwives and doulas are the same thing. This is false. So although doulas are fantastic and excellent labor support, they do not provide clinical medical care the same way a midwife does. And the last thing is midwives don't provide medication, which is also false. So prescriptions for things like diclectin, which is sometimes prescribed for morning sickness, things such as medication for urinary tract infections, yeast infections, and antibiotics can all be prescribed by your midwife. So those are some really common myths. Drop in the comments below if you've heard any other midwives or any other myths about using midwives, because I would love to hear them. Here are some benefits of having a midwife. So a midwife is a clinical medical professional who helps women who are pregnant give birth, as well as the aftercare of the baby and the mother for up to 6 weeks after having the baby. So a midwife will book appointments with you. You would go into the clinic and they would measure you. It's a lot less formal than maybe with an OBGYN. They don't often take urine samples, and they will do measurements and weight. They will also talk to you about your options and your choices of different tests that you have throughout your pregnancy. They also provide ultrasound, requisitions for ultrasounds and blood work, just as an OBGYN would. And then when it comes time to actually giving birth, you have a team of midwives who you've seen throughout your whole pregnancy, and you are guaranteed to have one of those midwives be at your birth to help support you along and hopefully help you give birth to your child. Afterwards, there is a team of midwives that will take care of your baby and take care of you, and they will come to you for the first visit in your home. And will help you with breastfeeding and postpartum care and things like that. And you also go to the clinic following up once a week for the 6 weeks afterwards to make sure baby is growing well and that you are healing well as well. Here are some pros about going with an OBGYN, which is an obstetrician, to provide care while you are pregnant and in labor. So for an OBGYN, it's very clinical. Usually they will see you in their office, and they will often take your measurements, your weight. They will do urine samples to make sure that there are no yeast infections or urinary tract infections. And they will just take a lot of stats and records. They also talk about everything that you might see along your pregnancy. And when it comes time to giving birth, you may or may not actually have your OBGYN deliver your baby. So this is something that a lot of people don't always know, is that depending on who is at rotation at the hospital, it might not be your actual OBGYN that you will have to give birth to your baby, which is okay, because oftentimes they will follow up to make sure everything went smoothly and to check out how things went. So sometimes they will want to try and induce you a little bit early so that you can be on their shift and they can make sure that you have the baby during their shift. So to each their own, and to everybody making their own choices. The biggest thing about deciding where you would like your birth to take place and how you would like your birth plan to go is just understanding that yes, you can have a plan, and yes, you can voice your wants and concerns. However, there are still things that might need to be done for your safety or for your child's safety. So it's important to be flexible and understand that your plan might not go 100% according to plan, and that that's okay. And it's okay to be upset about that as well. sometimes we have a beautiful vision in our brains on how we want our birth to go, and it doesn't always end up that way. But the end goal is always to have a healthy mom and a healthy baby at the end of everything, and that's what everyone hopes for.